Well, thank you for tuning in once again. Today what I want to talk about is joint disease. You might be wondering, why am I, a psychiatrist, doing a video on rheumatic disease, specifically arthritis? Well, before this is my third or fourth specialty, depending on how you look at it. My PhD is in experimental pathology, which is the study of disease, so kind of general there. And then I went on to specialize in lymphoid neoplasia, or cancer genetics. And after that, I went back to medical school, got my MD, and then I went into radiology. And I switched out of radiology into psychiatry. So on two of those levels, both from a pathology perspective and as a radiology perspective, joint disease are big deals. I've been at least diagnosing joint disease for years. And in my patients that are psych patients, it is really common for people to have arthritis, okay? And one of the reasons that I have a special interest in this particular malady is because I have it, okay? Which means that I'm very interested in ways to treat it because it's painful. And if you don't have any joint disease, you're amazingly fortunate, because those of us who have it understand that it's very hard to enjoy life and to feel peace if it hurts every time you move, okay? Moving your legs, moving your hips is, when it's painful, it's hard to really enjoy things for a while, okay? And with rheumatoid arthritis, that means we get it everywhere, okay? So it's not just one joint. It's not like a knee or your back. It's whatever the fruit of the day is, you know? I mean, some days it can be the ankle so bad that I can barely walk. Other days it's the knee or both knees or the elbow or the fingers. The only joint that hasn't become inflamed is my toes. I think that's about it, and I'm not even sure about that. There could have been some toe involvement too. I don't remember. It happens when they flare up. It happens a lot, okay? Now, I can tell you that the worst joints to have inflamed are your neck joint and your hip joint. And the reason I single those out as the worst, and I feel really bad for you people that have neck arthritis or hip arthritis, because with most other inflamed joints, when you sleep, you escape. Okay, sleeping is awesome because you go to sleep and the pain goes away. And as long as you stay still, you're fine. But with the neck, please, you try to go to sleep and you're fine until you try to change position, then the pain is so bad it wakes you up. So comfortable sleeping is difficult when you have neck arthritis. And with hip arthritis, for some reason, when your hip is inflamed, with other joints, as long as you stay still, you're cool. At the hip, it hurts all the time. Even when you're laying still, there it is. Throb, throb, throb. So I feel for you. When you have arthritis, these joints, oh my gosh, it really affects the quality of your life. So as a psychiatrist, if I can help, I try to, all right? And so that's why I offer supplements to help take away some of these symptoms. Now, I am not saying that these are going to be cures for your arthritis at all. There is no cure for arthritis other than joint replacement. Then there's your cure, right? But these are things that help to mitigate the severity, to reduce the pain, and hopefully reduce the joint damage. Now, my grandparents had rheumatoid arthritis, and my grandmother, that kind of came from my grandmother's side, and then my mom had it really bad, and then I have it, and I started having symptoms in my 20s. And I have been using supplements since my early 30s, and so it's been decades that I've been on these. And I will say that the use of supplements has, in my experience, greatly reduced both the pain, and they've protected my joints from actual joint destruction. When I've had my joints x-rayed, there is no evidence of joint destruction, which is impressive considering 30 years of disease and no joint destruction. That's impressive. I'm impressed by that. Okay, so that tells me that these supplements may be protecting the joint from destruction. And what that basically involves is this. When you have rheumatoid arthritis, your body's own defenses are attacking your joints. So your antibodies, your T cells, and all that kind of stuff, it's attacking you, all right? Bad. And so if they're allowed to continue the attack, then the cartilage that protects your joints is eaten away. And once it's completely gone, you're down to bone on bone, and then you get joint destruction. Now, with the supplements, in a nutshell, what I think is happening, and I think there's evidence to support it, is that as your antibodies are destroying your joint cartilage, the supplements help your body to repair the damage. Okay? And if you keep up with the process, then even though you're in pain because your body's attacking your joints, if you can restore the damaged portion while you sleep, and you wake up and you get fresh joints, you can therefore experience maybe some of the pain from the arthritis, but you don't end up disfigured quite so fast. Okay, so in a nutshell, that's what we're going to be talking about. Now, I don't want to produce another hour-and-a-half video, so what I'm going to do is to break this joint repair formula down into 5 segments. Today I'm going to be talking about SAMe, and then we'll be talking about other ones. So SAMe is the first one we're going to talk about. After that, we're going to talk about the use of undenatured type 2 collagen. And those two have really the strongest support, the strongest literature support for efficacy when it comes to treating arthritic joint disease. Okay? And then we're going to talk about glucosamine and chondroitin sulfate after that. Following that, the use of ginger powder as an anti-inflammatory agent, which does have quite a bit of, for just dealing with the inflammation and pain, there is quite a lot of evidence that it's useful for that. And certainly, if you've listened to me and I've told you about ginger powder, you know how it works, and so I know it works, and if you tried it, you probably know it works as well. And then lastly, we'll talk about the benefit of vitamin K2. Okay? So today, let's get in on it, and we're going to be talking about the use of SAMe for arthritis. So first of all, let's take a look at this first slide, and what you see is a lateral section of a knee. The patella is your kneecap, and so that orients you as to where you are. So you're looking at your knee from the side. From the top, you see your femur, that's the large thigh bone, and underneath that, it's coming in contact with the tibia. So the femur and the tibia form your knee joint. Now, between the femur and the tibia, you see this white stuff they label as cartilage. That cartilage forms a fibrous plastic covering so that stops your bones from coming in contact with each other and grinding on one another. So imagine, like us putting a plastic sponge between those two bones, and that's what you move on, and that buffers you from experiencing bone-on-bone action. So instead of bone, it's bone-on-cushion on bone. Okay, so that cushion protects the two bones from coming in contact with one another. Because if those bones come in contact with each other, they're going to grate on each other and chew each other up. So we don't want to see that. We want that plasticky protection between them. And what is that plastic stuff? And I'm saying plastic because we can identify with the texture and feel of plastic. It's not really plastic. It is connective tissue. And that connective tissue, that articular refers to joint. Okay, articulation, joint. Okay, so articular joint space is the space between two joints. And so articular cartilage is that connective tissue between the bones in a joint. Okay, and they show it as white, and I think that's it. Think of it as this gleaming white cushion between the bones. Okay? Now, when you have osteoarthritis or rheumatoid arthritis, what we have is some destruction of that connective tissue. See here, you see that pothole? That big old space where normally the patellar head, or the femoral head here, that's not the head, the femoral joint here is covered in that white connective tissue. And you see that big hole where you can see bone underneath, that is osteoarthritis, or it could be rheumatoid arthritis, but it is because of arthritis, we have eaten away or damaged away that protective cartilage. And now, ow, 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 every time you move in that joint, that's going to be a sore spot, okay, because there's no cushion there. So when we're talking about articular damage and the damage from joint inflammation, that's what we want to avoid. And if possible, we'd like to repair that. Now, I'm going to tell you right now, if you came to me late and you're already looking at joint replacement, or you've been told that the x-rays show that you are down to bone on bone, these supplements are probably not going to help you very much. You may get some benefit from the K2 and the ginger, but these other guys, not so much. If you don't have cartilage, enough cartilage in the area, and it's worn completely away for the most part, you're not going to get much benefit. And I think that's one of the reasons why there were several studies looking at these things which didn't show any efficacy at all. It didn't show that it improved things. If you include people in the study whose arthritis is that advanced, you're going to see minimal to no effect. So I hate to tell you this, but if you have severe arthritis with x-ray evidence of significant damage, these things may not be helping you very much at all. I'm going to warn you about that right now. If you're earlier on in your disease, where you still, you just started having symptoms, it hasn't been that long, it's really hurting you, but it hasn't gone on for years yet, there's hope. Because if there is cartilage there, what these supplements help to do is stimulate that cartilage to repair itself. In a nutshell, that's what these things do, provided that your disease is not too advanced. Right, so, in a nutshell, how do you restore normal joint connective tissue? In order to fully understand that, in order to get any of the explanations that I'm going to be giving you, you need to understand what articular cartilage or joint connective tissue is made of. All right? So there are three big things that joint cushion is made of. The first thing, chondrocytes. Cytes means cell. Chondro refers to cartilage or cartilage-making cells. Chondrocytes. As we age, we produce fewer and fewer chondrocytes. I have a slide in this deck, when we'll get to it, that show that when you are around 30, 40 years old, you have around 5 to 6 million chondrocytes per gram of tissue, something like that, okay? That's a lot. Now, by the time you get to be 70, 80, you're down to around 2 million. It gradually goes down over time, which does help explain why is it that as we get old, osteoarthritis gets worse. Well, that's one of the reasons. The cells that make that cushion become less. They drop by about a third as we age. Now, people with osteoarthritis, for you guys, guess what? It starts at around 2 million and it stays consistent. But healthy people, it starts up here and goes down with age. People with osteoarthritis, maybe rheumatoid arthritis. I haven't seen the data on rheumatoid arthritis. I'm just assuming. But anyway, you see this, okay? But it's low. It's low. Now, with low amounts of, chondrocytes make the two things that make up your joint connective tissue. So chondrocytes make joint connective tissue. What is joint connective tissue made of? Two things. One, type 2 collagen. Okay, type 1 collagen is in your skin and stuff like that. Type 2 collagen is fibrocartilage, and that is the collagen that is in your joints. So the chondrocytes make type 2 collagen, okay, and proteoglycans. All right, and what are those guys? Type 2 collagen provides the cartilage with strength. It's fibrous strength, so think of tough cords, okay, really strong cables, and that gives the joint cartilage its strength. And then between cables, you have this glue that is it's glistening and slippery. Okay, so proteoglycans make the joint moist and slippery. Think of it as like lubricant for your joint. Now, if you have lubricant, what does that protect you against? Wear and tear. Okay, so if you've got a lubricant in here, you're moving all around, but if you have a nice slippery surface, okay, your friction coefficient is not going to be quite as high, and that prevents you from wear and tear. Same thing with your car. When you add oil to your car, you want those pistons surrounded by oil. What does that oil do? It increases it reduces the friction coefficient, which cuts down on metal-to-metal wear. Your car will last longer with oil in it. Same thing with joints. You want those proteoglycans to keep that joint moist and slippery to prevent excessive loss of joint connective tissue. Okay? So hopefully you understand that, because if you do, then what I'm about to say next is going to make a lot more sense. Okay? All right, SAMe. SAMe, there are many different brands of SAMe. I've listed 3 that I've used quite a bit. All right, that first one, I believe, was from Puritan, Puritan.com. The second one, Doctor's Best, which you can get on Amazon or other websites. And then Nature Made, they were the ones that really came out with SAMe first. That's kind of like your gold standard. These were all good. I bring this up because the brand does matter. As somebody who suffers with rheumatoid arthritis, who has received benefit from these agents, when there are certain generic, well, they're all generic, I guess, because this is not a name brand thing. Nobody has the patent right now, so it's out there. But there are some brands that for some reason, they just don't seem to work. And when I use them, my arthritis comes back big time within a few days. So I don't know what it is about their formula, but they don't all work. So I'm going to tell you that. This is my personal experience. I have not consulted Consumer Reports. I've not looked at any actual literature to support this. I'm going from my experience and my mother's experience, because both of us have rheumatoid arthritis. We've been taking these products for years, and I will tell you from that experience that there is a difference in brands. So I don't recommend every brand, nor do I have any financial stake in any of these companies, by the way. When I talk about natural agents, I've got no financial ties to any of this stuff, okay? This is what works in my experience. I recommend certain brands, but you can pick whatever brand you want, okay? I'm not selling anything, so I don't sell anything out of my office, and I don't recommend just one brand a lot of times, unless one brand I've seen significant superiority, but usually that's not the case. Anyway, next slide. All right, S-adenosylmethionine is a common substrate involved in methyl group transfers, transsulfuration, and aminopropylation reactions. It is a very important molecule. It is produced by pretty much every cell in your body, especially the liver. Okay, so it does a lot. It does a lot. Okay? It's a cofactor used in many, many different types of chemical reactions in the body. Now, one of the things that was noticed long ago, way back in the 70s, was that SAMe is involved in the production of monoamines. Monoamines include norepinephrine and serotonin. And so they said, hey, if this increases production of norepinephrine and serotonin, then potentially it could be like an antidepressant. And so they did trials way back in the 70s. Now, this was back before it was available as a pill. Back then, the only way you could get it in your body was to inject it. And so they did, and they found, whoa, it helps with depression. Well, now we have over 40 studies that show that it works for depression. The most recent studies that I saw showed that it actually, when compared with a medication such as Lexapro, it demonstrated superiority over Lexapro. All right, now here's the problem. You say, well, that's great. Why don't we just prescribe SAMe for depression instead of Lexapro? Well, number one, it doesn't have a very long half-life, so if you want to use it for depression, you're looking at 2 times a day. But number two, the dose required to beat Lexapro was quite high. I mean, you're talking 1,600 milligrams a day and up. That is going to cost you well over $40 a month, maybe $50 a month. That is several times as high as prescription antidepressants, okay? So, and the side effects of the antidepressants really aren't that bad. So I don't often tell people go get SAMe unless I'm having a really hard time getting somebody's symptoms under control, okay? But anyway, I digress, because I'm not here to talk about SAMe for depression. Maybe I will talk about that some other time. But when they did those depression studies, what they discovered was that the people that had arthritis felt better. They noticed a significant reduction in their joint pain. And that is what started the investigations. And again, there's been a bunch of them since then, taking a look at its efficacy for arthritis. And it turns out, yeah, people do report less inflammation, less pain and suffering with the use of SAMe. Now the question is, okay, we have all these studies that show that, and I've got a bunch of them up here. Since there have been 9 clinical trials in Europe and 1 in the United States, actually more than 1, because the data that I got this from is kind of old, so it's actually more than that. But over 22,000 participants have shown that the SAMe is helpful for the treatment of arthritis. Now, I'm going to talk about later, toward the end, what I'm going to be mentioning is that if you go to the most reputable clinical medicine sites, the most reputable sites, they will tell you the evidence is inconclusive, don't use it. And I'm going to describe that why. One of the reasons I'm going to tell you right now is that the quality of these studies, these were mostly small studies, and they're spread all over the place. And you don't see the quality of study that you see with an actual clinical trial for a drug. But do you know how much clinical trials cost to get FDA approval? You guess? You guess yet? Because you're not going to know if I didn't tell you. It's $2 to $4 billion. All right. Now, there is no company that's going to do that kind of research for a generic substance, for a substance that you can't get a patent on. It's not going to happen. So we are dependent on these small studies. But these small studies will never equal the confirmatory power that you get with a true FDA study. And so that's why when you go to those websites, those really reputable websites, they will tell you, it might work, but the evidence is equivocal because of the poor quality of the studies. So I'm just letting you know that right now, okay? But there are a lot of studies, even though they're small, quite a number of studies show that it does help with the treatment of arthritis. Now, how does it work? Here, this is very interesting. This is very impressive. One of the things that it does, and not many things can do this, but one of the things that it does, certainly in animal models, is it increases mitosis of the chondrocytes. Now, I mentioned that as you get older, chondrocyte number goes down, from 6 million per gram to 2 million over the years. I mean, that's a big drop. And so here's something that can stimulate mitosis in your existing cartilage-producing cells. And the more chondrocytes, the greater the amount of connective tissue in that joint. So that's one mechanism by which this may be reversing the damage from the arthritis. Okay? Now, in addition to that, it increases proteoglycan synthesis. Remember, that's the stuff that in between the type 2 collagen, that's the proteoglycan stuff. I'm going to talk about that a little bit more and show you some slides in case you have a hard time visualizing that. Now, in rabbits, what they did was they gave them SAM-E versus control rabbits that got placebo, and then they basically took, then they went through and they looked at the cartilage in the joints of those rabbits. And what they found was that the number of chondrocytes, the number of cells, and the depth of the cartilage were significantly increased in the SAM-E treated rabbits. Now, that's a big deal. I mean, this validates what I just said, that what the SAM-E is doing is increasing mitosis in the chondrocytes, and the increased number of chondrocytes results in an increased amount of proteoglycans, and so that's your articular cartilage. That's the type 2 collagen is more of it, and more of your proteoglycans, and so both the lubricant and the fibrous component of your articular cartilage is increased by doubling or increasing the number of chondrocytes. Now, we don't have this in humans. Wouldn't it be great to have a human study where we showed you take the SAM-E, and the group that got the SAM-E, it doubled, it caused the chondrocytes to increase in number and increase the density and width of your articular joint space. Wouldn't that be great? The problem is you got to have people that are willing to have a biopsy done as a part of the study. It's going to be difficult. See, rabbits are a lot easier to work with. You offer a rabbit a carrot and they sign the consent form. They don't even read it. Okay, so that's why we have these great studies with animals, but not so much with humans. In combining both the human trials as well as the animal trials, where you have a cell culture and you have chondrocytes growing in the cell culture here, right? And then you add SAM-E to one group of cultures and not to the other, and then you look at the differences, and then you'll see chemical changes in the chondrocytes that got the SAM-E versus those that didn't. Okay, so based on those studies, based on animal studies, based on human studies, there are 4 things that SAM-E appears to be doing. A, it's reducing pain and stiffness. Okay, why? Well, it makes sense. If you are increasing the integrity of your articular cartilage and the width and the density of your articular cartilage, you're providing cushion, and so you're keeping bone from touching bone. So yeah, but in addition to that, look at number 3, reduction of inflammatory mediators. Whoa, okay, that's another thing. If it reduces inflammation, that will also, because when you have joints, a joint that's irritated, that's under attack, those inflammatory mediators result in pain and swelling and everything. So it appears to also reduce inflammatory mediators in addition to the mitotic effect. And then number 2, stimulates the production of cartilage via increased chondrocyte mitosis, increased production of glycosaminoglycans, and increased production of collagen fibrils. So the whole ball of wax, we're increasing the number of chondrocytes, we're increasing the production of type 2 collagen, and we're increasing the production of glycosaminoglycans. Remember, that was the lubricant for the joint. So all of them are bumped up with the use of SAM-E. If you had to pick one of these agents to use and you didn't have money for anything else, this would be the one that I would recommend. Okay? And lastly, increases levels of glutathione. And glutathione, if you followed me with any of my other videos and we talked about the damage that oxidation does in the body, oxidation is also affecting joints, and the more inflammation you have, the more oxidation. It also increases levels of glutathione in the joint, and that reduces oxidative damage to the joint as well. So you are protecting the joint from inflammation, from oxidation. You're increasing the integrity of the articular joint connective tissue by increasing the number of chondrocytes and type 2 collagen and glycosaminoglycans. Okay? So a lot of things. I mean, it's like the perfect thing for trying to repair the damage. Now, does it fix rheumatoid arthritis? Absolutely not. I've been taking this stuff for, really, to be honest, 30 years. 30 years I've been taking SAMe. And if I forget to take it, well, I go one day, I've got pain that's only 1 to 2 out of 10. 2 days, now it's 3 out of 10. 4 days, 6 out of 10. Okay, all right. The longer I go without it, the worse it comes back with a vengeance. If I take it on a daily basis, pain is pretty much minimal, like practically zero, to be honest. I mean, it keeps the inflammation under control. Now, does it stop my body from attacking my joints? No. Apparently not. If it did, then when I stopped it, I'd be cool. But it comes right back when I stop. So it's just keeping it at bay. It is not curing anything. Now, this particular article from the Annals of Rheumatic Disease, 2004 issue, this was interesting because in this study, they basically looked at the effect of aging and chondrocyte number. And I alluded to this earlier, that as we age, we produce fewer and fewer chondrocytes, and therefore our articular cartilage becomes less and less, making it more likely that we're going to get down to bone on bone pretty quickly here. Okay? And now here in this little square, we have a schematic of articular cartilage, and I just want you to be able to visualize what are the components of that joint connective tissue. Well, what we see here, look in the black box, what we see here is, okay, the first thing, in the middle there it says composition, and then you have type 2 collagen fibers, chondrocytes, and proteoglycans. So the first one down, type 2 collagen fibers, those are the bluish-white thick strands. And so those are the cables that strengthen the articular connective tissue. And then between those cables, you have this spiderwebby stuff called proteoglycans. And they have these little feathery structures that hold water in the joint space, and that provides your lubricant. All right? And so that makes, and then you have chondrocytes. I talked about those. Okay, so those are the components of the articular cartilage. And here we see a collagen, piece of type 2 collagen, and just shows you what it looks like. I don't want to go into detail on that one. I just want to show you what it looks like. Now, here we see those proteoglycans, and I want you to, this is important because later on when we get to some of these other recommendations, this is going to show some relevance here. But notice that the proteoglycans are made up of a core protein. If you look over here on the right-hand schematic, you see the core protein, and then you see these leaves that look like conifer leaves. It looks like Christmas tree branches. All right? Now, each one of the needles on those Christmas tree branches are composed of one of two molecules, either chondroitin sulfate, and that is a glycosaminoglycan, or keratin sulfate, another glycosaminoglycan. So when you hear them talk about glycosaminoglycans, we're talking about chondroitin sulfate and keratin sulfate. And those Christmas tree branches attract water. They have a negative charge, and so they attract water, and that's what gives the joint fluid its moistness, its viscosity. That's what makes this a lubricant for your joint. All right? And what does SAMe do? It increases the production of both type 2 collagen and these proteoglycans, or glycosaminoglycans, okay? So there you go. Here we see it up front, up close. You know, the actual chondrocyte, the type 2 collagen, and then our Christmas tree proteoglycan aggregate made up of those things that I just talked about, the keratin sulfate and chondroitin sulfate. All right, and here you see a microscopic view of what cartilage looks like, and these greenish roundy structures are your chondrocytes, and the pink granular material between them, that is your extracellular matrix. That's your glycosaminoglycans or your proteoglycans that act as your lubricant. So that's what a healthy joint joint cartilage looks like. Right? So essentially, what this articular cartilage, this articular connective tissue is doing is providing a slippery, durable, moist cushion that it protects bone from grinding against bone. All right, so this is that article describing how chondrocyte number and proteoglycan synthesis it ages over time. And this is the slide to make that point. So as you can see, when you're around 40, you have almost 7 million chondrocytes per gram of wet weight. And then by the time you get to be 80, you're down to around 2 million. So almost a 4-fold drop in the number of chondrocytes per gram weight in your joints. So as you can see, that is why, as people age, arthritis becomes a thing. So what I like about SAMe is it gives me something that I can do to help offset that loss. If I can stimulate mitosis of my remaining chondrocytes, then maybe my arthritis won't be so bad. So this is a Koenig study. It was nice because it lasted 2 years, and they looked at 108 patients with osteoarthritis of the knee, hip, and spine. During the 2-year study, patients received 600 milligrams of SAMe a day for the first 2 weeks, followed by 400 milligrams a day thereafter. And according to the study, there was improvements in clinical symptoms only after 2 weeks of treatment, and it continued throughout the trial, and not many side effects. So again, there are several studies like this. This is one of the better ones. This particular study was issued by the U.S. Department of Health and Human Services, and SAMe was found to be 80% more effective in treating pain associated with osteoarthritis compared with placebo. They also found that compared to treatment with nonsteroidal drugs, SAMe was at least equally effective, but it didn't have the same serious side effects that you see with nonsteroidal anti-inflammatory drugs. Now, this is Medscape. This is a website that I do consult quite a bit. I often, when I'm looking for drug-drug interactions and I'm not sure, I will consult the checker in Medscape, so I do sign up to this site. And for the most part, it's a great site, and I recommend. They have usually pretty good medical advice. However, with regard to taking SAMe for arthritis, they're not too keen about it, all right? They basically looked at a number of studies, and their conclusion, after looking at a huge number of studies that were published, so here's their conclusion. Another agent, S-adenosylmethionine, is a European supplement receiving significant attention in the United States. Okay, this is from 2019. I don't know why they call it just a European supplement. I didn't realize that, so that's news to me. Anyway, a systematic review of SAMe found that evidence was inconclusive, with a number of small trials of questionable quality. The authors concluded that the effects of SAMe on pain and function may be potentially clinically relevant, but are expected to be small. Whoa. Now, I first read that because I had a patient who pointed that out to me, that they looked it up, and they weren't impressed that SAMe was of much value. And so that was presented to me, and then I looked it up, and I'm going, whoa, I'm shocked. I was very surprised by that. Partially because I've been using it for such a long time, and not only have I seen it help myself, but I've been treating people who complain about their joint problems for 20 years, and I've had such good results with it. So I was surprised by that. But then when I thought about it, I says, okay, remember what I said earlier. If your arthritis is severe enough to where you're down to bone on bone, or if you're missing a huge chunk of the cartilage in a particular joint, this isn't likely to be a benefit. Remember, it causes mitosis of the existing chondrocytes. If you have worn away patches in your joint so that you don't have any chondrocytes over a large area, as I said, this is unlikely to be effective. And when you have studies that include people from a variety of stages of arthritis, from those with minimal arthritis to those with no joint tissue left, well, guess what? The balance is going to be a small effect or no effect. But in my belief, and again, this is my opinion, If you were to do studies on people with earlier disease so that they still had, some chondrocytes there, I believe that the results would be different. I started using this when my disease was mild, before I lost significant articular cartilage, and that's probably why I've had such good results. If somebody waits to beyond this point, I can't, just looking at the mechanism, I don't see that it doesn't make sense that you would experience such a robust response if you take into account the proposed mechanism of action. Okay? So that probably explains why we see this null factor where you look at a large number of studies and overall the effect appears to be mild. If we only, again, my opinion is if you only included people with mild disease, I think what you would see is over time they would be more stable and have less symptoms because you would have existing chondrocytes to act upon. Okay, hope that makes sense to you. All right, I don't mean to discourage you. You can try it even if you have more severe illness, but I don't think you're going to get the robust benefits that people with milder disease are going to see. All right, and this is from the Cochrane database, a systematic review, and they took a look at S-adenosylmethionine for osteoarthritis, and they similarly had some rather discouraging conclusions. They said the current systematic review is inconclusive, hampered by the inclusion of mainly small trials of questionable quality. The effects of SAMe on both pain and function may be potentially clinically relevant, and although effects are expected to be small, deserve further clinical evaluation in adequately sized, randomized, parallel group trials in patients with knee or hip osteoarthritis. Meanwhile, routine use of SAMe should not be advised. So this was extremely discouraging, and what they say is it will consider it when we have adequately sized, randomized, parallel group trials. Okay, adequately sized. Again, who is going to pay? Because what you're suggesting is, hey, let's use the type of trials that we use for prescription medications. And who is going to pay for that? So if you have mild to moderate arthritis, I do recommend that you try it. Okay? If it doesn't work, it doesn't work. But if it does, this can save you a lot of pain and improve the quality of your life. In addition, it can actually help some depressive symptoms again, but as an antidepressant, the doses are quite a bit higher than what we use for arthritis. So I'm discouraged by this, and I do find it a little bit depressing that they actually said don't use it, because I have used it, and so many of my patients have received benefit from it, and over the years. And so, all I can do is say, this is based on your anecdotal reports. Well, yeah, I know. And most of the time, if that's all somebody has is anecdotal report, hey, I tried poison ivy extract for a year, and guess what? I don't have testicular cancer. Well, just because you did that doesn't necessarily mean that you were protected by the substance. That's crap science. But here, you have a lot of studies demonstrating some efficacy here, albeit they are smaller studies, and they're, some of these are industry sponsored, and so you take it with a grain of salt. So, some of these times, I've shown you some of the references here. Read the papers yourself, and you decide. Or if you just want to try it, the side effect profile is pretty decent. The only side effects, if you're going to have them, usually is some nausea, because it does increase production of serotonin, and serotonin production in your stomach for some individuals can result in some nausea. So that can happen. It's rare, but it is possible. So I think that's it for SAMe. Oh, this just shows you different stages of arthritis: doubtful, mild, moderate, and severe. And so, as I was saying, if you are in the severe category, it's less likely that you're going to get significant benefit from SAMe. But in the other categories, there's hope. And again, it's my recommendation that you give it a shot. Some people, if it's mild, and you're talking maybe 400 milligrams a day. If it's moderate, then I would go to the 800 milligrams a day. Okay? Once you're down to bone on bone, the likely benefit of SAMe is small. So that's it for the section on SAMe and arthritic joint disease. I hope you get some benefit from that. Many of you are really struggling with this, and I feel your pain, literally. And if this helps, awesome. And that's why I put it out there. Again, mostly these videos are for the benefits of my patients, but what I hope is that it shines a light on your understanding of why this may be of significant benefit in the treatment of your arthritis. Again, we're not curing anything, but again, the hope is that it'll improve the quality of your life. Next up, the use of type 2 undenatured collagen for arthritis.